Hi, Dr. Bradshaw here at Chirocynergy. Today we're here to treat foot pain, and in particular the plantar fascia. So if you can think of my hand for a moment, or your hand, as a foot, and this is your heel, here's your midfoot, and then here are your toes, okay? You should have an arch, so there's a little bit of arch underneath your foot like this. And running from the toes, the bottom side of the toes, to the heel is what's called the plantar fascia. It's like almost like a trampoline, but a little bit more firm than your typical trampoline. And it runs from here to here. It has some give and allows the foot to stretch like this, but it gives it support too. When the foot flattens out due to lack of foot strength or bad shoes, wearing flip-flops all the time, you have no support, your foot starts to drop down, and that fascia, which is this long in length, as the foot lengthens, so does the fascia. And as that fascia stretches out, it starts to tear. It almost never tears here towards the toes. It starts to tear here towards the heel. And that's where you start to get that inflammation called plantar fasciitis. And so we're going to treat that underneath here, that plantar fascia. And we're going to do that using this, our little friend, the golf ball. Okay, so you will need one of these. This works the best. Some people use, there are different things that you can use online, like little pegs on them, little spokes on them. I personally don't think it works any better than a golf ball. And most people have a golf ball laying around the house somewhere. So here's how you're going to do it. You are going to have to take your shoe off. So, shoe comes off. You can leave your sock on if you want. The sock is not important. Golf ball on the ground. Place your foot on the golf ball. And you are going to roll that golf ball around underneath your foot, back and forth. And you put some decent amount of pressure on it. I don't think you're trying to push the golf ball through your foot. That becomes very painful. But to your own pain tolerance, you will feel some tenderness underneath different spots. Where you find tender spots, that's where you need to go back and forth and keep working on that. Back and forth, back and forth, back and forth, okay? Generally, I tell somebody when they're doing this, once they start, you should not stop for 5 minutes and work the heck out of those tissues underneath your foot for 5 minutes. When you are done, I want you to ice it. Because that fascia gets stretched out, there's inflammation there. When you go in there and break up those knots and adhesions and scar tissue underneath there, it creates a little bit more inflammation. So you need to ice it. So put some ice on the ground, put your foot on that, and let your foot rest on the ice for a good 10 to 15 minutes after you're done doing this. So 5 minutes of this, 10, 15 minutes of ice after that, and you're going to do this 3 times a day. Sometimes you have to do it 6 times a day. Depends on how bad the fasciitis is. I will say this, as you are working up towards your heel, and that ball is getting up into here, if you have a heel spur, you must be careful not to push into that heel spur, or you will create pain and it will last for a couple of weeks. You'll create a bone bruise. That does not feel good. So if you know that you have a spur, do not get it up underneath the heel here. Don't push too hard here. Okay? You can roll in through here and here and all in through here. But you can't get it up on the tip of the heel here. That's going to be a problem. Alright? Sometimes we don't know if you have a heel spur. It's better to err on the side of caution and stay off of the heel when you do it. Just get all the other tissues around that, heading up toward the toes. Okay? Get yourself a golf ball, get it on the ground, and start doing your work today. This will help. Have fun.